We've all been here before, whether it's a sports injury, car accident, or whatever other unforeseen circumstances lead to your injury, it's going to happen to you at some point sooner or later. And unfortunately for most of us, that injury is probably going to be a broken bone. Now, current treatment for broken bone tissues varies greatly. Most broken bones only need to be immobilized with a cast or sling for anywhere from a couple of weeks to several months, while more complex breaks are usually going to involve invasive surgery with screws, plates, and pins. Now, what they don't tell you about broken bones is all of the side effects that come with it, most notably the long hours you are going to have to spend in physical therapy. And if you're like me, that physical therapy is not going to be perfect, and you'll end up with a loss of X amount of range of motion due to excess scar tissue building up in joints and injury sites. But what if there's a better treatment for orthopedic injuries? One that decreased prognosis while increasing the overall outlook and functionality of affected bones? Well, thankfully, there's currently a model in the works in nanoscaffolds. These nanoscaffolds are made up of polymers that are roughly 10 to the negative ninth meters, or about the size of small molecules like the glucose molecule we see here. Scaffolds are currently being tested as a way to stop scar tissue from forming in injury sites and joints near them. These scaffolds can do this by creating a lattice network from each end of the injury site that allows certain molecules in that are usually small, like blood cells, much the same way as the plasma membrane works in our cells. Much in the same way here that you see the scaffold is acting as sort of an exoskeleton, or as we were saying, membrane around the building, it's able to let in the small molecules, like in this case workers and structural material, so that you can actually build the base structure inside of this lattice. The good news is that the procedure to get the nanoscaffolds into the body is extremely minimally invasive. You just synthesize your polymers and then add stem cells and directly inject it at the injury site. Here, those nanoscaffolds are going to adhere to each end of the broken bone and then form that lattice network until it creates a sort of bridge. Now, inside of this sort of tubular bridge, the stem cells will adhere to each end and begin to multiply until you fill in the gap with new bone tissue. The lattice network actually acts to keep out larger cells, like the ones that are going to form scar tissue, so that the stem cells actually have a 7 times increase in effectiveness. Unfortunately, the nanoscaffolds are not going to be quite as uniform as building scaffolds, but you can kind of get a general idea of what they look like here. This would be an actual example of a nerve cell repair. This actually leads me into my next topic in where the research is currently headed. So right now we are at the most basal level of tissue engineering, and bone cells and skin cells, as they're some of the easiest to replicate. The next step we need to take is to move on to being able to increase or fully replicate nerve cells. Now, damage to nerve cells such as these is a huge problem in orthopedic medicine, as most nerve damage takes months to years to actually heal, and even when it heals, it looks something like this. Not fully synapsed and only able to conduct sensations of hot, cold, and pain. And if this technology does take off, then we could see people with spinal injuries that would normally leave them unable to walk, able to recover in a matter of months and lead perfectly healthy lives. So from here, at the level of nerve engineering, we'd move on to organ engineering, such that you would take a sample of tissue from your body and then be able to grow whatever organ you may need from that tissue. Stem cells like these could become complete organs like this, to the point that they would actually be completely identical to the genetic tissue in your own body, so that your body would have a much lower chance of rejecting it, and you'd have a successful transplant without having to wait for someone that was marginally close. So then, what's the downside? Well, the biggest issue that faces this technology is actually that of ethics. Not the classic should we play God, but a much more simple idea in that anyone should be able to benefit from this healthcare, not just those who can afford it. While I do have my doubts that growing an organ is ever going to be a cheap procedure, I definitely think that we could see a high use of nanoscaffolds in third world countries, especially with patients that have traumatic injuries. In countries where medical care comes from field hospitals and clinics such as this, a simple broken arm comes with a plethora of problems that do not exist in the US. A broken bone that could be set with a sling like this and come out perfectly fine in a matter of weeks could easily end up like this in a third world country, leaving the joint useless and the arm immobile for the rest of the patient's life. And if surgery should be needed in clinics such as these, then the risk of infection would almost warrant not getting the surgery in the first place. But if you could give a simple injection that would heal bones quickly and effectively, allowing these people to get back to their everyday lives and not have to worry about the possibly life-threatening consequences of a surgery or a deformity involved with a broken bone, then it's really our duty to make sure that these research projects keep getting funded and that no social hierarchy ever exists based on what medical care you either can or cannot afford. So then, what does it all mean? What am I trying to say? Well, I'm just trying to say that you need to keep these technologies in mind and realize that this is only one simple use of nanotechnology that we will hopefully see in our near future. So until then, educate yourself about these topics and keep an open mind, Because as of yet, the possibilities are endless. And for now, next time you come up short on a jump or you get in a car accident, realize that you could see a technology that would allow you to get back to normal faster than you ever imagined.